All of my medical training was in a rural setting, first in Thunder Bay, then in southern Alberta. In the late 2000s, I was doing telehealth with fly-in Indigenous communities in Northern Ontario. In a world before smartphones, what we were doing was advanced, but we had never considered providing virtual care to people who were 2 hours away. 10 years later, I began working as a GP oncologist in Lethbridge. And by that time, I had heard lots of travel stories from patients. Snowstorms, car accidents, missing work or school pickup. The many challenges introduced from a day's journey to receive medical care were common themes throughout my practice. Then, COVID-19 happened. Within days, we had to entirely shift how we delivered medical care and triage which services we could provide at home. Despite my rural training, I had never been taught how to do medicine virtually. I remember sitting in my office, gripping the phone, hoping that I could still do my job. Determining how to get the right information was hard at first. It felt strange relying completely on the patient's descriptions and assessments. It was also hard working with my team. We were in different rooms and seeing patients at different times. It felt fragmented, and after a couple of weeks, I was exhausted and I missed people. One morning, a month into working virtually, I had a consult with an elderly single man who lived in a cabin up in the mountains. He had no computer or internet access, so it would be entirely over the phone. He had been treated for prostate cancer for years, and every 3 weeks he had driven into Lethbridge to visit me and get groceries before heading home. When I called, he greeted me, sounding a little unsure, before turning on speakerphone and introducing his sister, who was sitting next to him on the couch. They had been waiting for my call with a cup of coffee, catching up on how the trap line was going. For 30 minutes, we discussed how he was feeling, with his sister coaching him to be truthful about some of his side effects. It felt so relaxed and comfortable, so different than the anxious one-on-one visits we'd had in a sterile hospital exam room over the past 2 years. Over the next 6 months, we had many virtual appointments, and he was able to spend much more time on the trap line with his nieces and nephews. When it was time to stop chemotherapy, he did drive in to talk about palliative care, and seeing each other that final time gave us both a good sense of closure. Today, I provide both virtual and in-person care based on the needs of my patients. Right now, my oldest patient is 99 years old, and I have a virtual appointment booked with her this week. She only lives 20 minutes from the hospital, but her grandson told me how much easier it is for them to have their consult from the living room, and I'm happy and proud that I can meet them there.